Okay, can we start now?
Yes, we
Okay.
with schedule. Okay, I'm going to introduce our next presenter, Dr. Alain Chappell. For 25 years, he has been developing gene and cell therapy using non-human primates, immune-tolerant mice, and rats to protect against the side effects of radiation. He collaborates with clinicians to develop strategies for treatment of patients after radiotherapy overexposures. He has participated in the first establishment of proof of concept of the therapeutic efficacy of mesenchymal stem cells, MSCs, for the treatment of hematopoietic deficits, radiodermatitis, and overdosage of radiotherapy. He has contributed to the first reported correction of deficient hematopoiesis in patients, graft failure, and aplastic anemia, thanks to intravenous injection of MSCs, restoring the bone marrow microenvironment mandatory to sustain hematopoiesis after total body irradiation. He is a scientific investigator of clinical phase 2 trial evaluating the efficacy of systemic MSC injections for the treatment of severe and chronic radiotherapy-induced abdominopelvic complications refractory to standard. The title of his talk today is Clinical Trial Evaluating the Efficacy of Mesenchymal Stem Cell Injections for the Treatment of Chronic Pelvic Complications Induced by Radiation Therapy. Okay, and he has already shared his screen, so please, Doctor, please start.
Dear organizers, I wish to thank you for your kind invitation. My name is Alain Chappell. I belong to the Institute of Radioprotection and Nuclear Safety. Mission of my institute are to understand the effects of radiation on the environment and on the human body. I will present you my work of me and my team about stem cell therapy for the treatment of severe tissue damage after radiation and exposure, and we will focus on clinical trial. Cancer concerned 14 million of patients in 2012 and will increase to around 20 million in 2025 with 30% of mortality. The main cancer concern abdominopelvic cancer with 29%, with in this part of abdominopelvic cancer, 10% for colorectal cancer, prostate, 8% cervix, uterus, and bladder also. The anti-cancer treatments are surgery, chemotherapy, and radiotherapy. But you have to know that radiotherapy is included in 60% of treatments. And we will see now that radiotherapy causes damage to healthy tissue in the field of irradiation. Here you have an example of treatment of tumor of prostate. Here you have the irradiation of tumor, and you can see that a part of the dose delivered to the tumor is on the rectal wall, which is highly sensitive to radiation. So the efficacy of radiotherapy requires an optimal compromise between normal tissue here and tumor control, that is a risk-benefit ratio.
Yeah.
Radiotherapy causes damage to healthy tissue, such as the rectal wall of colon here, of rectum, surrounding tumor. We name this damage pelvic radiation damage. For example, in bladder, uterus, and prostate cancer, the organ at risk after radiotherapy are rectum, which developed proctopathy, and bladder, which developed cystitis. after a prostate carcinoma, after 7 years, 15% of patients who receive radiation therapy will experience a grade 2 rectal sequela, cystitis. And 7% will have a grade 3 sequela. If we consider the most documented data, which concerns the cancer survivor in USA, around 15 million of patients have a cancer, and 40% of these patients have an abdominopelvic cancer. 60 to 8% will develop acute effect, which will be solved in few months, but 10 to 20% develop late effect, which concern pelvic radiation disease. And the pelvic radiation disease concern 2,000 patients in 2017, and will be increasing in 2026 to 2,050,000 persons of pelvic radiation disease estimated. The main problem is that chemoradiation enhances survival, but also increases the risk of pelvic radiation disease. The result will be an increasing cost for society. The result is a repeated hospitalization for palliative care. This is also an ethical problem to help this patient with irreversible degraded quality of life. We can say that pelvic radiation disease remains a major side effect of radiotherapy without established effective treatments. I will expose now why we retain cell therapy to cure these side effects. First, you must know that we can consider mesenchymal stromal cells such as an injury drugstore. I mean that the secretion of protein on exosome by mesenchymal stromal cells induce tissue regeneration by downregulation of immodulation, anti-apoptotic effect, anti-fibrotic effect, and anti-angiogenic effect also. These effects are mediated by a trophic effect on also on stimulation of endogenous stem cells. For all these results, MSC constitute one of the most therapeutic tools, the most move forward for the regeneration of the tissue repair, with more than 263 clinical trials in the world. We have worked for 15 years on the effect of mesenchymal cells on irradiation of colon on fibrosis, and I will expose now her results. Our laboratory and other teams have demonstrated in this pathology that mesenchymal stromal cells migrate in irradiated tissue and use mucosa regeneration. Here you have a mucosa destroyed of intestine destroyed by irradiation. Here you have a blood vessel destroyed by irradiation. Here you have a strong inflammation, fibrosis, and a pain for patient. And you can see in first that MSC migrate in damaged tissue, regenerate endothelium integrity and function, have a pro-angiogenic effect on this tissue, have an inhibition of inflammation also, on an inhibition of fibrosis, on the reversion of hypersensitivity, but also for which is important for intestine, MSC increased contractibility. The consequence is an increase of survival. And we have many reports about that from our labs. So this is a result This is the reason why I summarize all this work here. It's more simple to understand. So, between 1987 and 2006, the radiotherapy department of Jean Monnet Hospital, France, had a series of mistakes leading to an overexposure of many patients. The results are mainly human error, poor interface of radiotherapy machine, and lack of French manual. The consequences are that for patients with treatment for radiotherapy prostate cancer, 400 patients have been overexposed while obtaining a confirmational radiotherapy of prostate cancer. Radiotherapy error consists in the process of treatment of cancer, prostate, and bladder with an overdosage of 20% of 10% of 453 patients. The clinical consequences are severe for 24 patients. The patient treated for prostate cancer are exposed to this overdosage with case of severe rectouretral fistula, 7 present post-irradiation injury grade 3 or 4, with discharging colostomy and complex fistula and rectovesicular fistula also, and colostomy and permanent urinary deviation and pain resistant. For this result, based on our previous results, for 4 patients with hemorrhage, rectal pain, severe proctitis, and refractory to conventional treatment, we have proposed a compassionate treatment by cell therapy for these 4 patients. MSC were obtained by culture from bone marrow aspirate for their children. Culture and expansion of mesenchymal stromal cells were performed at ESAL France platform. 4 patients received injection of MSC ranging from 0.8 to 5 million of MSC per kilogram. For these 4 patients, we have demonstrated that pain, bleeding, such as rectorrhagia, diarrhea, and hematuria decrease, and also the fistulization is stopped by this treatment. So we have concluded that systematic MSC therapy is safe, effective on pain, hemorrhage, and inflammation. Long-term effect in inhibition of chronic inflammation and fistulization was demonstrated. So, the clinical trial of phase 1 proved clearly the mitigation of severe side effects due to radiotherapy. This led us to propose a phase 2 clinical trial evaluating the efficacy of systematic mesenchymal stromal cell injection for the treatment of severe and pelvic radiation disease refractory to standard therapy. The name of this clinical trial is PRISM. This cell therapy treatment is offered to patients with PAD. Patient selection will be performed by the 6 radiotherapy centers participating in this study. Patients have daily rectorrhagia or hematuria pain and are refractory to conventional treatment of pelvic radiation disease. Inclusion is processed in Department of Hematology and Cell Therapy at Hôpital Saint-Antoine. A checkup should confirm that the cancer is in remission and that in general condition good health for this patient. The collection of mesenchymal stem cells is done on intrafamilial donor less than 15-year-old. This is a limit to ensure maximum viability of mesenchymal stromal cells. The eCell-France platform will ensure the MSC production of these cells. Support trial on intervention protocol will be embedded in the Department of Clinical Hematology Treatment and consists in 3 injections of MSC of mesenchymal stromal cells by intravenous injection from 0.8 million of cells for the first injection until 2 million of cells for the second injection. The follow-up will be done on 12 months and consists in decrease in rectorrhagia, hematuria on 10. Sorry, this is our team here that I'll present, and I wish you to thank you for your attention, and I will be happy to answer to your questions.
Okay, thank you.
Thank you so much, Dr. Chappell.
You're welcome.